and do a little welcome to whoever is listening, those who are joining us for this presentation on healthy neighborhoods by Diana and Pat. We're so happy to have you with us, sponsored by the Danby Community Council. And you can find out about more Community Council events at danbycc.org and also through the Danby Community News. So I think without too much further ado, I'm going to unspotlight myself and let Diana and Pat take on. Thank you.
Thank you. Hi, I'm Diana. I've been with Healthy Neighborhoods program for 3 years.
Hey, I'm Pat Jebet. I started with the program in 2010 when we first got the grant in Tompkins County. I was with it until 2020. I retired, and I'm just back to help out for a few months. So what is Healthy Neighborhoods program? The Healthy Neighborhoods program, which we call HNP, provides free home safety visits, and lately they've been remote with no contact these days to promote healthy homes. HNP is part of the health promotion program at the Tompkins County Health Department. It's funded by a grant from the New York State Department of Health. There are 20 counties in New York with this program, and a few of them had it for a few decades.
And as Pat mentioned, because of the pandemic, we are doing remote visits either over Zoom or a phone call with a no contact delivery of items to your home.
The objective of this program is to promote healthy homes in Tompkins County, addressing the following goals, which incorporates products and information.
To prevent indoor air pollution.
To help with asthma management for active and diagnosed asthma cases.
Prevent residential fire deaths.
Prevent lead poisoning with a focus on children. And this is mainly for homes that were built before 1978 when lead paint was still being used.
And pest control surrounding bed bugs, rats, mice, and cockroaches.
We also help focus on child safety. If we have young moms with young children calling, we provide a lot of child safety products for them and a lot of good information.
And injury prevention, which includes falls prevention.
So how does the Healthy Neighborhoods program work? We mentioned we visit homes, and we find people through referrals from other agencies, through community outreach such as this, word of mouth, and interaction with other staff. Sometimes people in environmental health might get a call, and the best resource would be Healthy Neighborhoods program for them. So we contact the person to arrange a convenient time for a home visit. And during our conversation, we'll introduce ideas to promote a healthy and safe home and offer products and educational materials to help determine what's best for the situation. And if referrals are needed, we can also provide those in most cases.
We will work with you to develop a plan to help make your home safer. We'll also identify products that may assist in that. And if we're able to, we will provide the products to help meet those goals. Subject to available supply.
Exactly. So smoke detectors, mostly for homeowners, usually apartments. They're hopefully up to date and where they need to be.
And carbon monoxide detectors. And both the smoke detectors and carbon monoxide alarms that we provide are 10-year.
Replacement batteries for people that have somewhat older smoke detectors and carbon monoxide detectors.
Radon test kits for homeowners.
We have some really good information about radon that we provide to homeowners also. Fire extinguishers. This is one of the most common things we give out. A lot of people either have really old fire extinguishers or don't have one at all. So that's a common product that we give out quite often.
Asthma management tools, which include a pillowcase.
Green cleaners, including baking soda, vinegar, scrub brush, and spray bottle.
And child safety products such as doorknob covers, outlet covers, cabinet latches, both the screw in or the slide, stove knob covers, baby gates, and corner cushions.
Sometimes seniors want those corner cushions too, like me, because running into corners, this softens the corners. It's a nice soft rubber. We also provide tick tweezers and what we call tick kits. It's got a nice assortment of Band-Aids and sunscreen and various things we can take in the car. This is nice to get the ticks off, and there's one for the animals also. We also provide masks and COVID test kits.
And bathtub strips to go down, put in the bathtub or shower to reduce the risk of slipping and falling.
Flashlights. And we didn't even talk about the pest control: mouse traps, rat traps,
Copper mesh.
cockroach bait, bed bug monitors, and copper mesh. And this would be used to seal or close up the holes where mice are getting in. So we could talk about that. If someone has a mouse problem, we can talk about that with them. It's time for the quiz.
Pamela, can you put the quiz up, please?
This is a really easy quiz, true and false. It's only like, I think, 10 questions or 10 statements that are either true or false. And it's not meant to trick anybody or trip anybody up like I'm doing right now. But just to get some information across. And so we will go ahead with that.
Go ahead.
Should go ahead.
Sorry, I'm just taking a moment to try and get the right spot.
Okay.
Oh, there it is.
Okay.
Is that being seen now? Whoops.
That's it.
All right.
Yeah.
There we go.
Very
All
good.
right.
Go.
Very good.
So
right.
let me, and do you want us all unmuted? So that
Yeah,
we
you
can
can just yell out
answer?
the answer,
All
right?
right, so
Yeah,
let me unmute. There we go, our participant. So we've got a set of true or false, and I thought I'd have it this big so it can be seen
Mhm.
easily.
Thank you.
Looks
Yeah.
good. Okay, vinegar and baking soda are good cleaning products. True or false?
True,
True.
true.
Correct.
Excellent. Smoke detectors and carbon monoxide detectors last forever.
False.
No, ma'am.
That's correct.
Excellent. Yep.
All right. Mold, perfume, dust mites, and smoke can trigger asthma symptoms.
True.
Correct.
Everyone should have and practice an emergency escape plan and have an outside meeting place.
True.
True.
Correct.
Yep. Excellent.
Mice cannot get into a home through a dime-sized hole.
That is
False.
false.
That is correct. Yeah, they can squeeze those little bodies. If their head fits, they can squeeze their little body through the hole. So
And I learned something interesting about a year ago, which is that mice can climb wood walls. I watched
Yes.
one climb a corner of my house on the outside and then go up into the roof. It's like,
oh,
wow.
no. Jeez, you're crafty.
If your carbon monoxide alarm goes off, get outside and then call 911.
true.
True.
True. Yes.
Humid conditions in a home can lead to mold growth.
True.
Mm-hmm.
Correct.
Correct.
Yep. Are you going to elaborate? Oh, right there. Mold needs humidity,
Thank you.
poor ventilation, and mold spores to grow.
My print is too small to read, so thank you.
Fire extinguishers with ABC on the front label can put out small paper, liquid, and electrical fires.
I believe that's true.
That is correct, yes.
Do you know how many seconds this size spray is? When you pull the trigger, squeeze the handles together, do you know how many seconds of spray there is?
No.
No.
8 to 12 seconds.
Hmm.
So it ain't meant for a house fire. It's just for
Yeah.
like a flare up, right? So, or a grill or something like that. Yeah. Okay. 2 websites for consumer information and product recalls are www.recalls.gov and www.foodsafety.gov.
I'm guessing it's true.
It is true. We
Yep.
just wanted to get
A
that
lo-
information out there. So
Yeah, and those websites have a lot of useful information.
Okay.
The Healthy Neighborhoods program provides free products, information, and referrals as needed for a safe and healthy home to anyone living in Tompkins County.
True.
True.
That is correct.
mhm.
I think I'll stop the screen share so we can see you.
Yep.
There we go. And ask
So-
ourselves to, well, those of us other than you will mute back.
All right. So I bet you're asking yourself, how do I qualify for the program? If you live in Tompkins County, you're eligible for the program. That's it. You do not need to own a home to participate. Tenants are welcome to call and encouraged to call, and they're eligible for the program as well.
No income guidelines. So the last part of this is confidentiality. We have a conversation about your home. We're not there to judge or be invasive. If you have questions or concerns with anything, we'll gladly try to help as best we can with any problems and refer you to agencies if we can't directly help you. Any identifying markers you provide to us, name, address, phone numbers, etc., are kept confidential within our program. Only our staff have access to this information. So that kind of wraps up our quick presentation. Do you have questions for us?
Guess we can unmute again. I don't. I'm going to actually stop the focus mode, I think. So we can now all be seen, I believe, or at least a little bit. So no, sounds very helpful. I'm glad that this service is available to residents. I'm guessing that not many people know that it's available.
Well, it's a little tricky. We were talking about it costs money to advertise, and we want that money to be put
Right.
toward the product. So that's why we do a lot of outreach.
Mm-hmm.
So, word of mouth is very powerful. We like to, spread the word. If I may, we also, when we bring the products out, we also put a packet of information together. And depending what the need is, there's all sorts of information that we have either locally or we've gotten from State Health Department or EPA or, wherever.
Mm-hmm.
So very comprehensive program and covers, as we were talking about, a lot of topics.
Yeah.
Mm-hmm. Yeah, it seems like you cover a great many different potentials for home hazards,
Mhm.
which I find very impressive. I think it's
Mhm.
great.
Yeah,
I certainly hope we can get more word out for Danbyites
right.
Yeah. Give
to
us some-
know of its availability at least.
Yeah. So this, is that in your, we didn't get a chance to read the article you had. Is the phone number in there for Healthy Neighborhoods?
Not sure, but we can make sure that we do a follow-up and get that number out. And
Okay.
just remind me, you may have mentioned this, is this a program through the county? How is this supported?
It's supported by the state health department. It's a grant. It's sort of soft money, but as of this year, there's a 5-year grant. So that'll take you to 2027 here.
Wonderful.
There have been times when it was a year at a time or 3 years at a time. And since 2010, it's been a little, you had to kind of on pins and needles to see if the grant would come through. But
Mhm.
this time, I mean, Diana's done a lot of COVID work under HNP. That was part of the last grant, was to incorporate a lot of either COVID enforcement or vaccination clinics that Diana's been working in. So,
Cool.
mhm,
Yeah.
Good work.
mhm.
Thank you.
Well, thank you very much. And yes, we'll help try to get the word out because this is a wonderful service, as Kathy said, covering so many different areas of home health, community health,
Mhm.
and it can be a real help to those who are particularly in rural areas. I'm just thinking the pest control alone.
Mm.
It's,
Yeah,
it's
yeah,
a current issue.
yeah. And radon is a big issue in a lot of parts of Tompkins County. And radon is the second leading cause of lung cancer, according to the studies that are out. So,
Yeah, it seemed like there was a lot of buzz about it. I don't know, 10, 15 years ago, maybe more.
mhm.
It's a little bit fallen off the radar, maybe because of things like COVID and
Other things, yeah, yeah, priorities, I guess, yeah.
yeah, but important to keep reminding people to check. So,
Mhm. Okay.
Yeah.
anything else you'd like to let us know about?
Did we mention lead? We can test
Oh,
for lead.
yeah, that's right. We can test, these are lead sticks that we actually can go in the home. Well, we used to go in the home more than we do now, but we show people how to use them. If lead is in the paint on the door jambs or the windowsills, you're gonna see a pink color like this.
Mhm.
Mhm.
So it's pretty easy to use. So when we go out, if people have homes that are built before 78 and they want us to check for lead, we do that for them.
Mhm.
Or we show them how to do it if it's inside. We used to go in homes,
Right.
but it's a little tricky now, so.
Mhm.
But yeah, another
Understandable.
important consideration for older homes,
Yeah,
especially where people have young children. So,
for sure. And radon too, because houses tend to settle. I was in a home yesterday where the basement had so many cracks in it that radon can come up through the cracks. If there's uranium underground, the uranium breaks down, creates radon gas, and that comes up through the cracks in the basement or through the cement, the porous cement. I'm
Mhm.
sorry, cinder block.
Mhm.
Anyway. I'll
and
go
if
into
someone
detail about
finds
this.
radon, what are the remedies for it?
Mitigation, I actually have it in my home. I live in Cortland County, which is the worst county in the state for radon. So my husband actually put it in, but you can hire a contractor. The range is, well, I shouldn't say, I don't even know anymore. He did it for a certain amount of money because he did all the labor. So that was a long time ago, but it did reduce the radon from 14 to like 1 in our basement.
Mm.
So it's definitely worth putting in.
Mhm.
Sounds like it. Sounds like it.
Mhm.
All righty. Well, thank you very much.
Well,
Thank
wonderful.
you.
Thank
Thank
you.
you. It
Yes,
was our
I'm going
pleasure.
to stop recording, but this will be available on the Danby Community Council website. So
Okay.
I'm going to